let's talk about a confusing and controversial area of medicine. And that is, what should I be eating if I have persistent pain? Now, for people who unfortunately do have persistent pain or chronic pain as we call it, then a lot of the time they're going to feel, well, I should just eat food that makes me happy. I should eat food that makes me comfy. And that's called comfort food, and we often know that means that's consumption of sweets and other highly refined carbohydrates, or it might be junk food, for example. So we often do see a lot of patients consuming this type of comfort food to see if it will make them happier, given that they've got the persistent pain, which obviously is a negative emotional thing to experience. And the other thing that might happen is they might actually lose interest in food. So they start skipping meals because they just can't be bothered. Their mind is fully taken up with getting through, surviving, dealing with this persistent pain. And so they don't focus on the extra effort that it takes to go eat something, especially the effort it takes to go eat something healthy. So let's ask ourselves the question, does it matter what you eat if you have persistent pain? Will it make things better or will it make things worse? Well, let's dive into a little bit of science to guide us about what is the right answer here. Because there's a lot of confusing, contrasting stuff that you can read on the internet, and a lot of it has no basis in reality. Now, as I sit here today at a little bit over 80 kilos, I'm actually composed of 79 kilos worth of me and 1 kilo of bacteria that is sitting in my gut. That's actually how much we have. Which is a lot. And in terms of the number of cells in my body, well, there's 10 times those number of cells actually as living bacteria sitting in my gut, in my gastrointestinal system. So there's 10 times many more cells of bacteria that I'm carrying around than is actually composed of me myself. So we have a lot of stuff. And obviously we need our bacteria in order to digest and break down food. So think of the bacteria, if you like, as a little factory that produces what we call precursors. So precursors are molecules that are made up of basic building blocks, and they can combine again and combine again. And these precursor chemicals are then taken up by our body. They actually go through the lining of the gastrointestinal wall, they go into our bloodstream, and they go to different parts of our body, including going to our brain. And our chemical signaling system that we have in our brain, we call these neurotransmitters. These neurotransmitters use some of these chemical building blocks that have come from our gut. So our bacteria are very much influenced by what we feed it. And it turns out that junk in equals junk out. Now, what do I mean by that? I mean that if we actually eat what nutritionists would call an unhealthy diet, then what our bacteria do is produce precursor chemicals that actually either increase the likelihood of experiencing pain or increase the chronicity of that persistent pain. So junk, rubbish type food in leads to probably more pain rather than less. So that comfort food that you went, oh, I just want to have a hamburger, I can't be bothered eating something proper, actually is the worst thing you could do to deal with the stress of the system that you're under, the stress of your body dealing with the pain, the mental stress of dealing with this pain. It turns out that the optimal precursors to actually decrease pain are found in what nutritionists call a healthy diet. And that is a diet that is surrounded by lots of fresh fruit, lots of fresh vegetables, a minimum amount of highly processed food. So that's a minimal amount of highly processed meats. So we're not really talking about healthy meat like venison, or here in Australia, kangaroo, as we eat it. But we're talking about those processed meats like ham and salami and so forth, manufactured burgers. So minimizing the amount of highly refined carbohydrates. Now, when we talk about refined carbohydrates, let's give some examples of what we're talking about there. The obvious one is sugar. Okay? Sugar is present everywhere in our foods, but the less of it that we can have in its refined sugar format, the better. So reducing sugar intake is important. Now, the other refined carbohydrate that is seen is what's called high fructose corn syrup. Now, that's not kind of obvious because that's blended into the ingredients on packets. So then you have to do a bit of extra work. You actually have to read what's on the packet in the supermarket and try and avoid ingestion of lots of that high fructose corn syrup, which is another form of highly refined carbohydrate. Typically, that stuff is found in very manufactured products, including a lot of junk food. So minimizing the amount of highly refined carbohydrates is important. Maximizing the level of antioxidants. So our antioxidants are particular chemicals that are found in fruit and vegetables, and generally they're often associated with color. So red fruit and vegetables, bell peppers and so forth, for example, have one type of antioxidant. And then yellow vegetables have a different type of antioxidant. And purple ones like beetroot have another antioxidant. So if your concept is, I'm going to eat a bunch of different colored fruit and vegetables, you're on the road to having a high level of antioxidants, and you're on the road to optimally feeding the bacteria in your little factory inside your gastrointestinal system to actually optimize the ability to reduce stress and to reduce chronic pain. Now, I'm not sitting here saying that if you do this, your chronic pain is going to disappear. That's not what I'm saying at all. But what I am saying is that what you eat actually influences what you feel and actually influences the amount of pain that you experience. And in particular, how you might respond to medications to decrease your pain, how you might respond to procedures to decrease your pain, and how much stress you can cope with, how much sleep you get, how restorative that sleep is. All those things are important. So the next time you're thinking, I can't be bothered, maybe you actually just take a moment, take a break, take a deep breath in, slowly let it out, and think about actually putting on a stir fry that evening to get your fruit and vegetable intake. So there's a couple of handy hints in terms of what's important, in terms of both choice of food. And then the other thing, of course, to talk about is the amount of food. So many times I'll see patients over a period of a couple of years, and they will be gaining weight, and gaining weight. And they might gain 5 kilos a year, for example, over a couple of years. And that has implications in terms of their mobility levels and what they can achieve. And what you find if we go in and we talk to them is that they're eating the same food that they always ate, not particularly different. They haven't doubled their portion sizes, for example. But what's happened is that their ability to engage in activity has disappeared. So they don't park the car at the far end of the car park and walk 200 metres to go to the supermarket. They might use the disability level, which is straight next door to the entrance to the car park. They take the lift rather than the stairs. They're not going for a jog. They're not going with their kids to the oval to kick around a footy. A whole bunch of things have changed, meaning that the caloric expenditure, the energy expenditure that they make is actually down significantly, especially if they'll do things like have a sleep in the afternoon, for example, which generally is not a good idea because it disrupts the nighttime sleep. So person who has reduced their activity level actually needs to reduce their energy intake, the amount of calories they eat. And if you're going to be eating calorie-rich food, then you really have to reduce the amount you eat and you'll be hungry. So one of the keys is to actually reduce the intensity of the calories. So eating calorie non-rich food, which of course is luckily linked to those fresh fruits, those fresh vegetables that have all the antioxidants that are what our healthy bacteria in our stomach need. So the two luckily go together. And that's the key to eating the right diet if you have persistent pain.